Like many patients say, when we heard your sounds and all, we felt as if you're doing some carpentry. Are you a dog person or a cat person? What's the most rewarding part of your job? How do you stay mentally and physically fit to perform at your best in the operating room? Are you a day person or a night person? Earlier, I was a night person. Now I've become a day person more. How do you handle patient anxiety or fear before surgery? So, hi, doctor. How are you? I'm good. Tell me. How is your day going till now? Oh, it's good. So, I'm going to ask 30 questions to you now. So, what was your favorite part of medical school? Favorite part of my medical school? It was a long school, so schooling, I have quite a few memories about it. Maybe I would say, you would remember something where your professors or your teachers have really shown that you are good in the class. Or maybe I would say my first year was, there was one incident where I felt it was one of my favorite is, I did well in my exams. And so our professor used to have tutorials so what he used to do is, those who scored well used to teach those who didn't score well. And then, it used to make you feel really good because you would learn and do more for learning and teaching also. So I think, so that was my physiology class, and somehow our professor was also very good. And I used to love physiology that time. And so that incident where, and there was one more in my prelims in my first year. There was a difficult question asked where hardly anybody could answer that, but I knew it so well, and I was writing from the start when I got the paper, and I could look around and see that most of the people are just scratching their brains and seeing. So, that was another place where I really enjoyed. But see, to make only one memory favorite is difficult, and I think third MBBS was also good, where you really get to the clinical part of medicine now. So, in MBBS, the first year is the basic sciences. Then second year, you are into the second part of basic sciences. And third year is where you get in clinically. So, second MBBS, you start your clinical postings, but you start to learn that in third year. So, third year is interesting because you're really looking at patients, you're seeing surgeries, you are interacting with professors, they are taking your lectures. So medical school is an interesting place. So were you the topper of the class? In some of the subjects, not all the time. What specialization did you think you were going to go into on your first day of medical school? On the first day of my medical school, I don't what think were you planning on the first day of the medical school you're really aware of what all specialities are there. Since I come from a doctor family where my mom is a gynecologist, I know how the life of a gynecologist is. Though it's quite interesting, but then I was like, maybe I don't think I want to do gynac because the life is quite hectic being a gynac. And so I was thinking maybe I wanted to do medicine. Then we had a very good professor in pediatrics. I think a lot of your, education is influenced by your teachers, how they teach you or how good they are. So we had, I can name him also, Dr. Ambedkar was the name. He's a very senior pediatrician. But the way he used to conduct himself, conduct the lectures, I think every student would like to be a pediatrician. But then later on, I felt, no, I would like to become a surgeon, because I wanted to become a surgeon and not just write medication. So surgery was what I was thinking of doing. And I'm really glad that I chose orthopedic surgery. Great. So, but that is after 20 years in practice. What's the most rewarding part of your job? Of my job? Okay. So there are many rewards which come with being a doctor. Of course, I think for me, the satisfaction of helping patients get rid of the pain which they come is really one very satisfying thing. Like especially after replacements, with the patients come to you on a wheelchair and then you see them walk around. I think that's something really great. And recently I met one professor of anesthesia also, and I was just discussing is that as an orthopedic surgeon, you're not increasing the lifespan or you're not doing anything with the life, but you're increasing the quality of life. So like, now there are a lot of people who are at advanced age having a lot of issues, and mainly we are treating them, getting them back, to
back on their knees. That's what I would say, getting them back on their knees. And I think that's really very satisfying part of my work, is to do a good surgery, get them back on their knees, and of course interact, talk, and yeah, when a satisfied patient really thanks you, I think that's the biggest thing for a doctor. Not that it doesn't come with its other rewards also. Of course, your financial rewards are there, but I think that was not the main thing when you get into medical college and start. But yeah, I couldn't ask for more.
How do you stay updated with the latest advancement in orthopedic surgery?
So now with technology being around, I think everybody can get in touch, because most of the journals are online. You can do online things, but also I try to go for conferences where you can also interact with the other experts internationally, nationally, share your views, take their views, and I think that helps a lot. So yeah, one thing is of course reading articles and all that, but I think the first-hand experience you get from other surgeons, their experiences with different things, helps you a lot to understand things differently. Sometimes even I feel when you speak with your juniors, their way of thinking. So it's not about just getting the latest things, but also updating, changing your thought processes about everything. So yeah, so I would say one is reading the journals, whatever is there in the journals, what's the newest and latest thing, but also interacting with your colleagues and with other experts. I think that's the way to be in touch with what's the latest which is happening, because a lot of things are commercially driven also, where we need to be a little careful. So when you talk with your seniors, what has their experience been, I think that gives you a lot of insight in what you need to pick up from the literature also, because there is a lot of literature. Like there is so much content now everywhere. It will confuse you too much.
Can you share a memorable patient success story?
There are many. So I'll really have to think, but there are many. Like there are some one or two patients whose I have one or two, or maybe even more. I've changed all the four joints of the leg, like both the hips and both the knees, and they are doing well. Recently, I had done I have been having patients who have been following up with me for past 20 years. I've operated them. I've done their knees 20 years back, and they are still doing well and walking. And they are telling me, "So you had told me it will last for 15 years. Now it's been 20 years. Kuch problem to nahi hoga na." So they are a little more concerned with that. I said, if you use them well, don't worry, there will be no problem.
What's the biggest challenge you face as an orthopedic surgeon?
There are many challenges, but I think there are many patients what I have seen is, when the patient doesn't connect with me, when I get the vibe that they don't trust you, I think that is a big challenge for me to still try and convince them that, what I am telling is, according to me, the best treatment option. Now, sometimes what I feel is a challenge is when a patient gets operated somewhere outside and they ask you an opinion whether that was done right. Now, I believe for any surgeon for that matter, it's not a right way to comment. And this is what I've learned from my teachers, is you don't know under what circumstances that person has, operated or anything. So I put I put it in a different way, and I tell my, whoever comes for such kind of opinions is, see, what I would say is maybe this could have been done better. But now, if you're asking me whether it was done right or not done right, I can't opine on that. If you ask me what can be done ahead, yes, I'll guide you about that. I think this is a difficult part, and I feel as orthopedic surgeons and who are colleagues of mine, or even like younger generation who are going to come and become doctors now, I would like to tell them is, instead of showing your colleagues down in front of your patient just to get a brownie point from a patient, is not a very great idea, because today it is somebody else, tomorrow it can be you also. We all are humans. Nobody is a god out here, and things can go wrong even when you are trying to do your best. And I believe most of the surgeons, most of the doctors are trying. I am saying, are trying to do their best to treat the patients. So I think that's the difficult part, and the issue with orthopedic surgeons is, so whatever they do, their mark sheets are with the patient, so the x-ray is with the patient, so it is always they are carrying that, and that can be shown to anybody, and opinions can be sought. So I think that is one thing. Rest of the times, as an orthopedic surgeon, what I have seen now with insurance settings, it is quite fine. But earlier on, the treatments used to be quite expensive because of the good implants were quite expensive. But now with insurance, people are okay with getting the best of the treatments. So one is orthopedics is quite a technology driven. I would say branch of medicine because there are a lot of equipment needed when you want to start your like for your surgeries, and if your equipment is not that good enough, you can't give good results. So it's again the chicken and egg story when you're starting your practice. But once you are in practice, I think you want to have the best to give the best results.
12 to 15 hours a day. So, how do you manage work life balance?
I think this work-life balance is something new for me. Like I just started to get into that balance because whatever I've seen, my seniors work at my mom work in the house. There was only work, 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 work. But they still used to find time for family and stuff that they enjoyed. I believe it depends on the stage of your practice. Like initially, I don't think you can think of work-life balance. Once you're settled down, when your practice is doing well, and then you feel, yeah, maybe you could cut out some time from your work and give some time for your other parts of your life, your personal life, with your friends, with your family, and other things that you enjoy to do. I think with age, you will slowly, anyways, understand getting and doing that.
What hobbies do you enjoy outside of work?
Okay, so so nowadays I've started liking sports. I've been playing badminton. I used to love swimming earlier, and of course, other than that, reading is what I have again started. Earlier, I used to read, but then with work becoming very hectic, it had I'd lost my knack for reading. But now I'm again gaining, and I'm really glad I have started reading again. And otherwise, it's catching up with some friends, watching, going for movies, and nowadays again, it's been to explore places. Maybe in the country and even outside. Travel is also one of my hobbies, to explore different places.
What's your favorite surgical procedure to perform and why?
Okay, so see, I specialize in doing knee replacements, and I'm doing robotic knee replacements now. My favorite surgery, I would say, if I'm used to, it's my knee replacements, my surgeries, that is fracture surgeries, because they give you kind of a challenge because every fracture has a different pattern. So a knee will be like a set things we need to do. So it becomes quite a routine thing to do. Of course, when there's a little bad deformity or a different kind of knee, yes, that is a little challenge. But sometimes the fracture patterns, they are so odd, and I think there is a little bit of more challenge there. Also, I do a bit of scopies, but scopy is also quite interesting. But yeah, I would put fracture surgery still as my favorite. But of course, knee is my bread and butter.
What advice would you give to aspiring orthopedic surgeons?
Okay, for aspiring orthopedic surgeons is okay. Now that orthopedics has become quite vast with so many subspecialties, I think you keep your options open of what you want to do. And I believe being a trauma surgeon is also a great thing to do because there is a lot of work there. There are very few general orthopedic surgeons left because now everybody is either a spine surgeon, an arthroplasty surgeon, an arthroscopy surgeon, or a hand surgeon, or a foot surgeon, or a pediatric surgeon. But then there are a lot of people who need a general orthopedic surgeon also, and they can think about doing that too. And yeah, you should be working with all kinds of subspecialties you want to do, but I think as the time goes, people would go into more of subspecialization, and yeah, orthopedics is a great branch. It is evolving still quite a lot. A lot of technology getting into it. Yeah, I think there's a lot of scope for all of us to work.
How do you handle patient anxiety or fear before surgery?
Yeah, that's a good question because most patients, most of the patients are quite anxious before surgery. There are only, like, I would say, experienced patients who are quite cool in the sense I've done one knee and now they are coming for the second knee, and then they are quite relaxed because they already had an experience of getting better, the whole experience of how things are going to be. Uh, many like sometimes it's quite surprising that many young patients are more anxious than the older ones. The anxiety part is it needs to be handled very carefully because different patients react differently to anxiety. But I do talk it out with the patients. I tell it's okay, it's a normal thing to be anxious because if anybody is undergoing a surgery is going to be under the surgeon's knife, there will be some kind of anxiety. It's okay. We also talk with them, try to relax them, and also we give them anxiolytic medication the night before so that they sleep well and they are not too worried because too much of anxiety will also disturb their sleep, and if they don't sleep well then the blood pressure goes up and then maybe the surgery may need to be postponed. So yeah, so basically it's of course a part of counseling with your patients. Whatever doubts are there in their mind, clearing them, telling them that if many patients ask what if something goes wrong. I said there are chances that something may go wrong, but they are very very few or very less. So you don't need to worry so much about it.
What's one misconception about orthopedic surgery that you'd like to debunk?
And that we like many patients say when we heard your sounds and all, we felt as if you're doing some carpentry. So when we are doing a knee, like after putting the cement, we need to really hammer in the implant so that it sits well on the bone. So yeah, we are kind of carpenters because we are dealing with bone, which is also like wood, which is hard. We're putting in screws and plates and everything. I won't say it's a myth. It's a kind of carpentry, but a little art, a lot of art also into it, and a lot of science into it. Otherwise, myth about orthopedic surgeons is that they are very crass and they are very harsh and they are very violent, and that's how it is also been portrayed sometimes in the movies. And they are alcoholics, which is not which is not at all the way it is. There are orthopedic surgeons maybe who are like that, but most of them are very sensible people.
How do you handle stress or pressure during demanding surgeries?
Okay, so demanding surgeries, I would say, is maybe I call another colleague of mine also. So to share the responsibility sometimes, I see to it, I plan the surgery before. I have a plan A, plan B, plan C because on table you can't do much. So it's better to always discuss beforehand and then think about the options that are there and not there. Thirdly, trying to keep myself cool is again very important because if I can't think well, I can't think what next I can do. So I think it's just how with experience you are able to handle the stress. But yeah, a lot of planning helps to reduce your stress considerably. And I basically feel operating in an environment where you're used to things, like if you're going to be doing something which is complicated, which is not the usual, it's always better to be in a place where you're most comfortable operating. Your anesthetist knows exactly what you want. Your assistants, the team knows what you want. You already ask for all the implants that we want on table. So yeah, so having a place where and that's my place, which is really I feel keeps me. A lot of my stress is taken by that, by people around me knowing what I want next.
Can you share a valuable lesson you have learned throughout your career?
I think one of the most valuable lessons I feel is to be very clear with your patients if there is also some complication. I think that is one valuable lesson I would like to give my juniors also. Maybe it's a little difficult. Again, you need to judge the patients also how much they understand and how much they can, take it in a proper sense. But being truthful helps a lot because most of the patients are understanding that it's a human body can react in a different way than what it was planned for. I would say is being transparent about the things, about the procedures, about the costs. If there is any problem, talking out about that helps a lot. And I think that is the valuable thing I would like to give my juniors is to be frank and open about the treatment options, discussing with them and telling them if there's something can go wrong, and it's with everybody I think so, something can go wrong, and you can maybe openly tell that if anything goes wrong.
How do you stay connected with your patients and follow up on their progress post surgery?
So usually there are set protocols like when the patient needs to follow up for every kind of treatment they have taken. Usually post-op patients, we are getting in touch through our physio. We are knowing what is their progress. If there are any issues with them, they are already given some emergency contact numbers of the of our hospital, that's Upasani Super Speciality Hospital, and also a particular contact person in case of emergencies, so that they can get in touch and let us know if there is any problem. Rest of the times, I think I can be in touch with my patients through these kind of medias like social media. They can follow me and know whatever I'm doing, what different work I'm doing, or whatever things they may want to know. They could also post in their comments so that we can make appropriate videos or on the same topics that they want.
Do you enjoy mentoring aspiring orthopedic surgeons or medical students?
Yes, I do, because I like many of the times I like the questions that they ask. I like the way they think. I'd like to tell them from my experiences what it has been. USSH is not a teaching hospital as such, but in between, due to COVID, there were even MBBS students coming in over here. We also have a fellowship under me for arthroplasty. And from my fellows also, it's a very good learning experience when I teach them something, when we interact, we discuss things. It gives me a great feeling of teaching. It's a good way of bonding with my fellows also, and I believe it's a nice way, for them to learn also, and for me to share my knowledge and my experiences.
How do you stay mentally and physically fit to perform at your best in the operating room?
Okay, so remaining mentally fit, I think, is also very important, as good as staying physically fit. And now that I've made a routine that I'm doing workouts, I'm going for a walk also, and alternating between the gym and yoga is helping me a lot. During yoga, when I'm meditating, it just makes me feel really great, keeps my mind calm, and though there may be a lot of turmoil around, I can try and still be calm and keep my mind in control. I think it's something great. Having great friends also is very important. I feel they can really buffer you from different kind of situations, and maybe I'm lucky with that also, that I have good friends with whom I can share my ideas, discuss, talk, and of course even your family members, they can also help you out, be a great support system for you.
Are you a day person or a night person?
Earlier, I was a night person. Now I've become a day person more, because I could stay up more in the night, but now I think with age catching up, it's the total day thing. I'm starting my day earlier on and finishing off early. Yeah, so now I've become a day person.
Are you a dog person or a cat person?
I'm totally a dog person, because maybe I've been used to having dogs when I was a kid. We used to have pet dogs, and now also I've adopted a stray, and I feel that's another relaxation technique you can all can use. It is whenever the dog comes and you caress the dog, and a lot of your stress is gone. So having a pet also helps for sure. And maybe adopting a stray rather than going for fancy breeds is also one great thing to do. Also, one more thing I would say is I like plants, and I like to plant trees. And even if you see in the hospital around, there are a lot of plants. And now, yeah, I feel we all need to plant trees everywhere, because it's too hot and the temperature just seems to be going up and up and up. We need to do something for the environment, and I think the minimum we can do is plant some trees, or plants at least.
If you could have dinner with anyone in history, who would it be?
Of course, there have been many great people in this world, but I think Osho is one very different kind of a person, and the way he used to think and convey his points have been like really great. And I feel maybe Osho would be one of the person. Maybe this sounds a little weird for people, but if you see or read about Osho, or nowadays there are a lot of reels of Osho coming on Instagram also, and I believe his thought process was totally different, and maybe Osho would be one of the persons from history. Maybe I could have dinner and a lot of discussion.
What is your favorite meal from the hospital cafeteria?
I rarely eat there, but what I've got from my patients is that your cafeteria is really good, and the food is quite homely and nice and tasty, not like usual hospital stuff. The snacks are really good, and anything I could have from that. No particular dish. That's the oxygen.
What does your normal morning look like?
My morning usually starts at 6, and I'm up by 6, and by 7 I'm either in the gym or doing yoga at home. After that I and rush, and by 9 I'm in the OT to start my cases. Usually I have at least 3 or 4 surgeries in a day, and after my lunchtime and after the rounds, if I have some time, I'm meeting some of my hospital staff to get some updates, and then by 4 or 4:30 I'm starting my OPD, and the OPD goes on up till 9:30. And so earlier on, after that, I used to go for a walk also, but then with the heat and I think it becomes too much to go for a walk. So my evenings have become a little lazy, so end up watching some television at home and then go to the bed. And before I go to the bed, of course, I do pray. I do read a few lines at least. And in the morning time also, I try and read some part of a book. And of course, thank God for the day, for whatever learning that I've had in the day, and try to think, and whatever things I didn't like, maybe I think why and how can I, improve on that, and thank for the good things.
So we are done with the questions now. So what are you going to do now after the shoot?
Oh, it's time for lunch, and I'm hungry, so I'm going to eat something now.
Chalo, let's go.